Hello, this is Dolopo. I'm a licensed acupuncturist, and today I'm going to do a case study on Bell's palsy. I'm going to go ahead and take off all the gear. I just wanted to show you what things are looking at like right now due to the COVID-19 situation. I'll take this off for now. This is my 21st year in practice, and I have not needed to wear scrubs in a very long time, and I donated all my scrubs and lab coats many years ago, and I just placed an order for at least 5 sets this week. As soon as I get home, I just take everything off, shower. I've got a family of 5, including myself and 2 dogs, so 3 children, a husband, and 2 dogs, like you can see in the picture. So it is a lot of work to make sure that I don't bring any germs home. I wanted to do a case study today, specifically talking about Bell's palsy, and I'm going to talk about a few cases that I've treated just this week, just so you have an understanding of what is it that acupuncturists do. Licensed acupuncturists in the state of California are considered primary healthcare providers. So what that means as licensed acupuncturists, being primary healthcare providers, is that ever since 1978, we have not needed the permission or the referral from a licensed physician or chiropractor or any other type of physician, medical practitioner, for patients to see us directly. Patients can see us directly. So I want to make this brief just so you can kind of get a sense of the issues that are coming in today. These are not people who just necessarily want to relax. These are people whose pain, their physical and emotional anguish, don't care about what's going on out there, no matter how severe the issues are. A woman has come in this week due to Bell's palsy. When a woman has had a paralyzed face on one side for a month, it's because, I'm pulling up her file, it's because she does not believe that it's going to get any better anytime soon. She waited for at least a month. That's what her doctors told her to do, and it wasn't getting better on its own. Today was her 4th treatment. I will give you the dates after I give you the results. In 4 treatments, well, basically in 3 treatments, today's her 4th. Her neck tightness is at least 60 to 70% better. Her right eye can blink much faster than before. It's not feeling as weak as it was before, and the tension in her jaw area is at least 70% better. So overall, she's 60 to 70% better. She's so much happier. The treatment dates have been were March 19, 20, 24, and today's March 27. So you can see that there was a 1-day, then a 4-day, then a 3-day difference between time frame in between dates of therapy for acupuncture. I do balanced method acupuncture. None of the needles go to the face. None of the needles go to the face. She's seeing rapid improvement, and I truly believe that is because she is being very aggressive. Aggressive as if you come 2 or more times a week. Being able to close her eyes. Today we were talking a little bit before she left, and I said just staying there, you look just at rest. Her face to me looks at least 90% better. She's been FaceTiming her mom. Obviously, she can't make physical connection with her mom, and her mom said on FaceTime that her daughter's face, my patient, looks a lot more normal, or what I like to call a lot more natural. So that is the Bell's palsy case. That is obviously a case that, in her opinion, is very dire to treat. She didn't want to wait another month. She is a mother of a 5-year-old son, and her husband's also still working very busy, and she's trying her best to entertain her little boy who can't go. Kids are not allowed to go play in the playgrounds, and they have to be very vigilant as to where they can go hang out as a family, like just taking a walk, but really they're homebound. So that is very stressful for a mom who's pretty much on her own, taking care of her son while her husband still works full time. She's a homemaker. So another type of case that's came in, he's come in twice. I'm treating a lot of registered nurses today, these days, due to the tremendous stress that they're under. Sure, I don't have to explain that. You can just look on the news. My cousin is a charge nurse outside of London in the ER, and she posted that, and this isn't the kind of post that she normally would share. She's a very humble woman. She and I are about a month apart. Our mothers are sisters, and they were pregnant at the same time. Anyways, my cousin Leeway, she stated how the other day she walked into work and everyone there the patients gave her a standing ovation. I think that's very, very special because she is among all the medical staff, medical doctors, nurses, PAs, everyone working in the hospitals. They are working the front line to take care of millions of people. I want to talk about this case. This is one of my registered nurse patients who had to come in. She had to come in on the 20th and the 24th. I treated her twice. She was 38 and 39 weeks pregnant. She was about 39 weeks pregnant. Her physician, her OB, was already inducing her, stripping her membranes and trying to get things moving along. She works at a hospital here in Orange County, and she was told that there was a strong possibility that if she didn't deliver by a specific time, that she may have to be in a situation where she would have to deliver alone due to the COVID situation, the COVID-19 situation. She would have to deliver alone without her husband there. That was speculation. I don't know if they're actually doing it yet, but it was enough for her to really, obviously I've been pregnant 3 times, so I know how intense the last 37, 38, 39, 40 plus weeks can be. She was already feeling uncomfortable, but to feel the stress of what's going on with coronavirus all around the world, and listening to her friends who are physicians and nurses and everyone working in the hospitals, and being on top of that, being pregnant, and knowing that if she didn't deliver by a specific time that she may have to deliver alone. My husband was always in the room, and she's already a mother of 1 before being pregnant, so she just did not want to have to deliver her child alone. There was also the stress of knowing that if she had any symptoms of a fever, any sniffles, or any kind of cold or flu symptoms, that she may have to be separated from her newborn for 2 weeks, and she did not want that. So it was my job to help prepare her for labor. I treated her, I believe, on the 20th and the 24th, and she delivered. She gave me a picture right. I'm going to just double check. She delivered, yes, those were the 20th and 24th. She delivered at midnight, right when it turned the 26th. The peak of the treatment hits within 1 to 4 days. So, she didn't have any symptoms before she, wanting to give birth before she started seeing me. And as soon as, the treatments, labor, she started having contractions. She asked me to really prepare her. She was just under tremendous stress. So I just prepared her, and I just let Mother Nature do her work. I didn't force the baby out. I've done a few natural labor videos, and I basically just let the body do what it's going to do. In light of what's going on, I really helped her relax. That was a huge part. In the last couple of weeks, just last week, 2 patients told me they're pregnant. Right now, I think that makes 14 current patients who are pregnant. I'm about half and half with natural fertility and with IVF fertility patients. You may think, why is it important to treat fertility patients? Well, a lot of these women have been especially the ones who've been undergoing IVF, there's a specific protocol that I have in order for the IVF to be successful. I think it's like a 35 to 40% success rate when it comes to the IVF. Acupuncture brings it up to a 50 whatever plus percent. I've done 10 fertility videos, so I'm not going to break this down here, but I just want to share that in the last week, two new pregnancies, one IVF and one natural. The natural one took 75 treatments from March of last year until March of this year. March 10 was her last treatment so far, and she's buckled down at home in order to stay safe. Some of these women, especially the ones who've been going through the IVF, they've had a history of miscarriages. So it's critical that they stay on a protocol to make sure that the IVF does take, that it totally works, because it's not just the expense of the IVF, but it's the emotional investment. So I'll leave that there. Like I said earlier, there are a lot of registered nurses coming in who are working the front line. We very much appreciate them. I very much appreciate them. I have family who are nurses, and they are dealing with tremendous anxiety and stress. And some of you who don't know what that does to a person, it can cause insomnia, migraines. You want your nurses to be able to think clearly if you have to be at a hospital and see them, or at a doctor's office. You need, but especially in a hospital setting, you need the nurses to keep it together, especially if they're charge nurses who are in charge of managing the doctors who are dealing right now with constant policy changes, because this thing is, now we have 100,000 confirmed cases of COVID-19 in this country, in the US. So I'm sure policies are changing all the time in the hospitals. The nurses are having to maneuver through these policy changes, what's going on with the doctors, and if they're charge nurses, taking care of the nurses. So you got the doctor care, the management, you got the other nurses to take care of, and they have their patients to take care of. So yes, helping them cope right now. I have a patient who's dealing with eye dryness, foggy brain. She needed her brain to work. Nausea, bad periods, and this woman lives alone. So today is her 10th treatment, and overall she's anywhere between 60 to 70% better. The migraines are better, the sleep is better, the eyes are better. The eyes are about 50% better in dryness, and she's still working. Her work is considered essential to the government here in Orange County. And so we need, and this is rather a new job for her, so she needs to be on top of it. There's no room for her to mess up. So the foggy brain, she can't afford to have that foggy brain. When she first came in to see me, she needed, I'm going to pull up her file, she needed to make sure that her brain works. So if you know of anyone or yourself who deals with a foggy brain, their brain not working, not being able to concentrate, this is what she's had to do in the last, today's her 10th treatment, or 20th treatment, in order to get where she's at. February 13, 14, 15, 17, 18, 21, 24, 28, 29. So just in February, 9 treatments. This is before the whole thing just kind of blew out of proportion with this virus. Then, so that's 9 treatments. Then March, 2, 3, 6, 7, 13, 14, 17, 19, 23, 24, 27. So that makes 20. Today's her 20th treatment. She feels much better. The magic for chronic issues, especially chronic severe issues with multiple issues going on, really happens after the 20th treatment. What I want to see is at least 30 to 80% improvement within those first 5 to 15 treatments. I have a very quantifiable way of seeing improvement with my patients of what I expect. I did a video called Accountability Part 4. If you go to my website, elementsinharmonyacupuncture.com, and you go under videos, you'll see Accountability Part 4, and I really detail how patients should hold my work responsible. So again, the dryness, the foggy brain, the brain needing to work, that's what that means. Nausea, bad periods, she expects her period next week. And this woman lives alone. So I wanted to touch upon that. There are people who live alone, And there are many people like me who have a family to go home to, or they may live alone, and or they may have a spouse, or they may have kids, they may have pets. Some people do not have pets. Some people do not have family. They have family, but they don't live with their family. They are truly alone. No pets, no family. They live alone, and they have to either FaceTime their friends. They're not getting their, their hugs. They're not getting their, hug quotas. And some people don't have someone that they can just communicate and share everything with. And being at work gives them the human contact, at least being able to communicate with people. And this is not talked about. And I'm going to get emotional about this because for a lot of those people, this is their place. So to keep everyone safe, you see that I have this. I have my mask. I just invested in a bunch of scrubs. So I could just start wearing scrubs again at the office. Our decorative dividers are now quarantine dividers. I just invested $200 something for 2 actual dividers. So things are going to move a lot more smoothly. People are at least 6 feet away. I have 15 tables and chairs. It's naturally slower. I shared this in a video recently. This is my 94th video. In my 93rd video, I really shared how people are taking advantage of the 6+ feet distance. The doors are open. Everything's ventilated. We want to make sure air moves. I've got Clorox disinfecting wipes everywhere. This is like liquid. This is like gold. We are set. I was already set before all this stuff happens. I'm making sure everyone's safe, including myself. I talk at the feet. I have gloves on for my non-needling hand. This is what I touch people with. And I wash my hands frequently. I pause that because my patient's, but she's on her phone right now. She's rolling back there. So let's see. I will turn that down just a little bit. Okay, so I thought she was calling me. I have a baby monitor, so if people need me, she knows she's by herself back there. And she is taking care of herself so that she can give 110% to work still. I have patients coming in for cancer therapy. Cancer could give a rat's ass about this coronavirus. And my patients who are undergoing cancer therapy, whatever route they choose, I'm here for supportive care to make sure that if they're doing the traditional oncology treatments, radiation, chemotherapy, or whatever alternative ways that they're treating, and I'm here to help with making sure that they have energy, nausea, that they can sleep. I would imagine that it's extremely stressful to know that a person is diagnosed with cancer, and making sure that their immune systems are strong. Some people still have to go to the stores and buy things. And believe it or not, it can be very, very stressful going to the store because some things just aren't available. And so I do implore for everyone to please only purchase what you really need. I'm having to hunt down for rubbing alcohol. I use it here, and now I have to get creative on how to make sure I have supplies for a very long time. I'm set for a while, but I like to think 2 to 4 months ahead. I've always been like that, and it really serves in this type of environment now. I have a patient who came in today. He's over 70. He had this is for post-knee surgery. He recently had knee surgery. He came in with a cane. He drove down from Downey, and he hadn't been out of the house for 4 weeks. And he, his wife drove him. He came in, hobbling in with a cane. I gave him a treatment, balance method. None of the needles went to the knee. He left at least 50% better. Within the first 2 minutes, he was 50% better. He was like, my knee feels so much better. He had been taking painkillers. And he was like, I can't believe it. And he walked out of that room almost not needing the cane. So yes, I'm happy to keep my doors open. I made sure that, he had his mask, he was on blankets, and, he just in and out. He was by the window or by the open door to make sure that ventilation's going. But when you have someone who's older, he's at least 65, who had surgery and could barely walk and unable to really maneuver around his house. Just because a person's housebound doesn't mean that they just want to sit all day. He is much happier, at least when he left here. He's going to come again on Monday to make sure. He just couldn't believe it. His knee is so much better. He was so happy. I have a patient who's a young lady. She's in college. She wants to become a nurse practitioner. But after seeing my work and seeing the results on my website, she is really now considering to become a doctor of acupuncture and Chinese medicine. If you go on my website I'll go on my phone, if you go to elementsinharmonyacupuncture.com, and if you go under testimonials, there are 3 sections for testimonials: fertility, and just regular testimonials, and testimonials for pain. If you go under testimonials, you'll see there's hair loss, insomnia, dizziness. And I'll just let you look at that page yourself. She wrote a lengthy testimonial. It was a great testimonial. You can see, I don't know if you can see, oh, it's just, that's her hair. And she had shared a picture right under her normal hair, and each month that the hair got worse. It was thinning and thinning and thinning, all the way back to June 19. So this was a severe case. Her hair is thicker than it ever was, and that was all acupuncture to strengthen her hair. I did give her towards the end herbs to help with sleep, but no herbs for getting her hair growing. So when she saw that, she was like, I need to come in. She showed me how much her hair had been coming out of her head. Another case that's coming in, this is all this week: facial paralysis. Now keep in mind, my patients are staggering. They're staggering. I'm making sure that they come in at staggered times, so we're not seeing a bunch of people all at once. They're staggering. They're keeping 6+ feet. They have that option, and I would say the majority of patients are wearing their own face masks, gloves, whatever they have to do, blankets, whatever they need to do to keep themselves safe. There's paper on my tables. The doors again are wide open. They come in for the treatment and they leave, knowing that they are powerfully boosted for their immune system. I talked about I have a different case for facial paralysis. This is extremely important. This woman has received, she's another registered nurse. She's a registered nurse for the ICU. She has been in practice for over 35 years. So she's a senior to me in many ways. She's been in practice much longer than me. This is my 21st year in practice. And she has received 90 treatments from May 28, 2019 until March 26, 2020. Today is March 27, 2020. So 90 treatments. She has appointments scheduled until June 20. I'm sharing this with you so you can see. And she drives from Cyprus, which is by Long Beach. She usually would deal with a lot of traffic to come to see me, but given this situation that we're going around, that this pandemic going around, she's not having any traffic, so that's a good thing. This situation with the facial paralysis, that's not Bell's palsy. This is a situation that happened post-surgery. She's a little upset because that particular surgeon won't admit that this caused it, this neurological pain, this neurological issue. I'm not getting involved with that. All I know is that I have to treat this. She would say she's at least 80% better. She can eat now without chewing on her inside cheek. She can close her eye better. She can, it feels normal, but I still need to aesthetically raise the lip. Like I said earlier, I started with Bell's palsy. When a person has facial paralysis, they don't really care about anything else because it's embarrassing for a person to go around with one side of their face drooping. At rest, her face looks almost 100%. It's just when she smiles, you can see her lip still needs to go up, but it feels normal. She just told me that yesterday. She said it feels normal. When she raises her eyebrows, one side goes up and one side stays down. So I still need to lift this. 90 treatments from May 28th until March 26th. So it has not even been a year. So if you ask this woman who is a healthcare professional, she will tell you that my work is extremely important. When this whole situation with the COVID pandemic started happening, I can tell you she was probably one of the most, she was one of my patients who really needed to know that I was still going to keep my doors open, because she knows how important it is to get consistent therapy, not many treatments. And only the most serious will say that in less than a year they've had 90 treatments. She is a healthcare professional. She would not keep coming in paying out of pocket if she didn't see results. She's on a couple of forums that talk specifically about this health issue, and she just is not convinced that another surgery is going to help this. Hopefully she'll write a review for my work one day that explains what the pros and cons were to doing acupuncture or doing the surgery. She has shared with me other people's experiences, and she wasn't convinced that going in that direction was the route she wanted to take. Again, I'm emphasizing that she's a registered nurse. She's an ICU registered nurse. So when I say that I'm treating a lot of healthcare professionals, including ER doctors, surgeons, you have to consider how much respect they have for Chinese medicine. I have been studying Chinese medicine since 1994. I've seen the texture of acupuncture and Chinese medicine increase or change in the last couple of decades. I've been licensed since 1999. We did not have this kind of respect in the past. I did have a pediatrician as a patient when I was an intern, but he was one of the avant-garde doctors who would give me a chance. And he was with me since I was an intern when I was practicing in San Diego. He just believed in my work, and he was an extremely humble man. He showed up at the acupuncture clinic at Pacific College of Oriental Medicine, and he didn't write down Dr. Joel. He put down Joel, and for work he just put down pediatrician. He didn't put some fancy letters behind his name, MD or whatever. He just was very upfront. This is what I do. He came to my graduation, and I would say that more than half the moms there at my graduation knew who Dr. Joel was, because he was a Kaiser physician, he was a Kaiser pediatrician, and his patients were about my age at that time, and they remembered their pediatrician. So anyways, that's a little side note. I talked about the IVF patients. I'm going to talk a little more about that later. I have a patient who's coming in to make sure that her platelets stay normal. Her platelets stay good. She started with 90,000 when she first came in to see me, July 27, 2009, or January 27, 2018. Her hematologist needed her platelets to be at least 150,000. If you go to elementsinharmonyacupuncture.com, you can refer to this case under several places, to two places. If you go to elementsinharmonyacupuncture.com, you can go to case studies, and then you'll see increased platelets. I'm very detailed in regards to the treatments numbers, not the actual treatment plan, but the actual treatment numbers, the dates. That's what I want to share with patients. If you go to testimonials, again, there are three sections: fertility, pregnancy, and delivery, and also the second part, or birth, and then the second one is testimonials, and the third one is testimonials pain. This one is under testimonials, and if you go to low platelets, Jeanette leaves my 245th plus Yelp review there. I'm very grateful to have received 250 plus Yelps plus a bunch of other testimonials, if that matters. She left 2 reviews, specifically talking about how I have increased her platelets. Her her treatment numbers are 90 total between January 27, 2018 and March 26th, yesterday. She received, 80 treatments. The other case I talked about was 90 treatments. This is 80 treatments. I have not touched my face all day, and now that my hands are clean, I'm touching my face. But normally I'm just constantly washing and not touching my face. It's a habit that I'm breaking, that we all need to break. So yes, so we went from 90,000 to 271,000. We beat that 150,000. It's critical for her to make sure that she continues her treatments. She wanted to make sure that also I was available. I don't have to work, I choose to work, because these are cases that really mean something to me, and I want to make sure that they're being taken care of really well. There was a case, young college lady. She just finished her undergrad, and she wants to become a physician. Rheumatoid arthritis. You talk to anyone who deals with rheumatoid arthritis, and they can tell you that it's not a fun deal. She's had 27 treatments between July 12, 2019 and March 26, 2020. She goes to UC Santa Cruz, or she just finished at UC Santa Cruz. So whenever she's in town, she gets treatments from me. She's in town right now, so she's coming in pretty aggressively. And yes, she came in yesterday and she said, I don't have any pain. She would normally feel pain in her hands, in her knees, in her feet, in her elbows. And she used to have, there was some psoriatic issues too, and her skin looks so much better. So I'm so happy to see that she's feeling much better. She would say that the acupuncture has a lot to do with her healing process. Right now is her perfect time to heal because she has time. She's done with her finals and she passed school, and I don't think there's going to be a graduation, unfortunately, but she's so happy to be done with school. I'm treating a lot of women's health issues. PMS does not care about a virus. These are women with not just a little bit of PMS, or dealing with a lot of PMS. Some of them are debilitating, and the acupuncture and the herbs help tremendously. The herbs help tremendously, so if I can just treat them with herbs and they don't have to come to the clinic, they'll do the herbs. Some women actually need both acupuncture and herbs. I want to make it very clear. For patients who don't need to come in, we're doing just herbs. Some patients respond better to acupuncture. The Bell's palsy case is not going to be treated with just herbs. That has to be acupuncture. In my opinion, that has to be acupuncture. I'm going to refer to that first treatment that I shared earlier. Today's her 4th treatment. I would not have gotten those results with just herbs. That's my opinion. That's me as a practitioner. I'm not going to talk about other acupuncturists, other doctors of acupuncture and Chinese men. I'm going to talk about my work. So the people dealing with PMS, especially if they're debilitating, if they can just be treated with herbs, they'll do it. But if they really need to come in to feel whole, painless, and being able to function and feel happy and not have the mood swings, they are coming in. The bloating, the migraines, the lower back pain, all that. Women dealing with menopause, perimenopause issues, hot flashes, night sweats, acupuncture helps tremendously. A lot of times just the herbs can help, but some patients really need the acupuncture with the herbs. So again, if they could be treated just with the herbs, we're doing it. Some women respond better to acupuncture. Migraines and headaches are some of my favorite things to treat. I'm having tremendous results right now with that. Due to the situation, many people are only coming in for these pain cases as needed. Just enough to get them through and focusing on the herbs. But some people, the results, especially with Dr. Tan's balance method, it's instant. It's instant, and they want to feel that way. So they're doing a combination of both. I'm going to refer to the IVF and natural cases right now, just so you get an understanding why these cases are so important for them to come in. Quite a few of these women have had history of miscarriages. So they find me and they're like, okay, I need you to please help me. We'll talk with the IVF cases. I have them coming 2 or more times a week until transfer. And then for natural fertility, I have a protocol. I said earlier about my case, the most recent positive case for natural fertility. That was 75 treatments. I asked for 6 to 12 cycles. I made it by the 12th cycle. I would have wanted her to do herbs beginning 3+ months, but there was a specific reason why she didn't do the herbs. But she got pregnant. 75 treatments in 12 months, and I'm so proud of her. It was a lot of work on both parties, hers and mine, and that was a lot of patience, and it was a lot of resources. So for the IVF cases, to get that positive, there are many women who are having to come in multiple times a week. One of my patients, I just communicated her. Okay, I'm back, and this is what I look like. I'm going to take everything off again, and I'm really grateful that my patient called me to tell me to get her needles out. She's been here at 7:53. She came in at 6, and I let her stay. She's my patient with all the migraines. Her migraines are gone now, pretty much gone. This is her 20th treatment. She was in the case I was talking about earlier. Her sleep is better. So the migraines, the sleep, and her foggy brain, and the dry eyes are significantly better. The eyes are 50% better, but everything else is at least 80%, if not more, improved. And something that I want to share that just got me heated up was she said that she saw a neurologist today, and I'm going to tell you just how it is. If you're a doctor, I hope you're watching this, especially if you're a doctor who don't support alternative medicine. She said it took everything she had to not punch her neurologist today. And I'm going to say this up front. I respect Western medicine, but you better start respecting Chinese medicine. I've been practicing this since 1999. And to hear a patient tell me that she was pretty much undermined by her neurologist, who said, you know what, before he even heard her story of how she's improving, he said, you know, you really need to go on antibiotics. Antidepressants. I'm going to prescribe antidepressants for all of your physical health issues because you must be depressed. And she said, actually, my migraines are pretty much gone, and I'm sleeping so much better. My eyes are 50% better, and my brain is working so much better, and I've been getting acupuncture, and today's going to be my 20th treatment. And he said, well, acupuncture is very relaxing, so it's just relaxing your stress. So it's just the acupuncture that's just making you feel just relax, but acupuncture will not cure you. All right, that's not how it goes. And I'm really going to try my best to be very compassionate and understanding with how this person thinks. This patient said, I'm not going to a spa to just get relaxed. She considers me her miracle worker. She considers me her doctor. Because without herbs, without medicine, without some antidepressant, with no side effects, she's feeling better. That's why if you go to elementsofharmonyacupuncture.com, you will see just results. Just results. This isn't just something like, oh, and I've been a licensed massage therapist since 1996. So I have nothing against getting a massage and feeling good. I get a massage every Friday. Minus this COVID situation, I'm not getting a massage every Friday right now. But to hear that, and and she said to me, I feel that if I was a man, the doctor wouldn't have just said, oh, you know, just go on antidepressants. Now that's speculation, but that's how she felt. And if that's how you guys are talking to your patients, like, oh, well, you know what? You're just stressed out, so just go on some antidepressants. You know go through my testimonials, and you'll see quite a few patients, especially the longer testimonials, where the patients will describe exactly how their personal physicians failed them, because that's how she feels. And I want a nice, harmonious relationship between Eastern and Western medicine. But if quite a few of you still think this is quack medicine, why don't you read some of my testimonials? Like stage 4 kidney disease, increasing platelets, increasing white blood cell count. Those are quantifiable results. These are not, oh, I just feel better and now my white blood cells are increasing. No, it's so much more than that. This medicine's been around for thousands of years, and you're just going to undermine it and undermine a patient who's been asking for help. And someone is actually being able to reprogram their entire mental and physical health so that they can feel better. And when you see results, I've done a testimony of a case study on lupus. When you can see the results on the lab test, it's not just getting relaxed. We're getting results, and that's the whole purpose of this case. When a person is healing from Bell's palsy that she had for a month during one of the most stressful times on this planet, where there's a freaking pandemic going on, it's not just an acupuncturist just sticking needles in them. This is an acupuncturist who's fucking doing work. That person can blink their eyes now. And when you tell a patient, oh, just go on antidepressants, hey, there's a time and place for antidepressants. There's a time and place. But when you tell a patient, look, just let the Bell's palsy go away. And it's not getting better. And they got a 5-year-old bouncing on them. And I know, my kids are 15, 9, and 2. I know what it's like to have kids bounce all over you. And she's about to lose it. And there are mothers stuck at home with their kids. And they can't go anywhere. Yeah, stress has a lot to do with it, but this is real medicine doing real work. In fact, just to let you know, and you can check my reference, you can check the references online, Chinese government is mandating anyone with COVID-19 infection, with anyone infected with COVID-19 has to, but it's mandated that they have to receive Chinese medicine, especially herbs. So yeah, got a little piece of my attitude. Stop thinking that this is bullshit medicine, because it's not. It's real medicine. I wouldn't have stuck with this medicine since 1999 if I didn't see real results. I remember this bullshit when I was working at the community clinics. The way that I was treated. It took a long time for me to earn the respect from people, but to see that a patient feels that way, you fucking should feel ashamed of yourself. She wants to leave that doctor now. And so I implore that if there's any doctors out there who have fucking balls to admit that maybe you don't have all the results. Maybe you don't have, not the results, maybe you don't have all the answers. We're trying to work together. I'm trying my best to work together with doctors so that we can find solutions to a variety of health issues. So, I'm going to finish this so maybe you can see how acupuncture is helpful. There's a reason why we are primary healthcare providers and why I've chosen to work during this pandemic. I have a patient with severe sciatic pain. She had a car accident on March 13. She was at a stop. She drives an SUV. The SUV behind her was also at a stop. The truck hit the SUV behind her and hit her. She came in on a scale 1 to 10. The pain is at a 7, sharp. Tremendous pain. During the treatment, none of the needles go to the area of pain. I'm using balanced method acupuncture. If you want to know what that is, you can just ask me. Or you can go to the academyofacupuncture.com. I'm on staff. This patient felt 50% better on the table. She left. About an hour later, the pain came back. She came in again today. 2 treatments in a row, on the table, 50% better. After about 30 minutes, the pain came back. This pain will go away. She is on muscle relaxants. The muscle relaxants don't help her. She doesn't take them during the day because they make her feel drowsy. So this is a woman who's still working from home and she has to work. So if you go to my website at elementsandharmonyacupuncture.com, you're going to see quite a few testimonials. I did a video on herniated disc and I did a video on sciatic pain. You can see the work there. There is a reason why this medicine is still necessary even in the midst of a pandemic. These are not people who are just trying to sit here and relax. These are people who actually need medical attention. Where Chinese medicine shines is when it comes to quality of life. I would say that helping a woman with migraines increases her quality of life. When a woman can say, or a man says that she can use her brain better and she can focus more, I've treated enough cases to know that's not just some psychosomatic thing, that they mean that. They really mean that. These women coming in for hormonal issues, those are not psychosomatic. They can really see changes in the treatment. It's not, oh, the acupuncture makes her feel better, so her pain makes her feel relaxed, or her pain, her severe abdominal pain, the debilitating pain is better. No, it goes beyond that. A woman just gave me my 250th Yelp review. I will pull it up. This is about a woman who had pain after thoracic outlet syndrome surgery. If you go to elementsinharmonyacupuncture.com and you go to neurological pain post-surgery, you can see the testimonial right there. It's in blue. She talks about how she was able to pretty much graduate from severe pain. Her neurosurgeon just wanted to keep doing more surgeries. Her pain specialist, different doctor, saw my work and saw that it had been helping her tremendously and advised against the surgeon's recommendation to remove a chunk of her neck to stop the muscle pain. That is exactly what she says. I'm not going to read the entire testimonial, but I will just say this. My surgeon suggested another surgery to remove the muscle in my neck because according to him, these symptoms would not go away on their own. You can ask that surgeon, if you ever meet that surgeon, what that surgeon thinks about acupuncture. There are surgeons who really love my work. I know because they're here. And there are surgeons who think my work is not valuable. This surgeon probably doesn't think my work is valuable. However, her pain specialist, another MD, thinks that my work is valuable. I'll just break down her treatments. 55 treatments between July 21, 2018 and December 17, 2019. In March, let's just start with 2018. In July, she had 5 treatments. August, 3 treatments. So in 2018, she had a total of 8 treatments. Not very aggressive. Except for in July, kind of, because that was, 5 in a month is not very aggressive. Then in 2019, March, she decided to start doing a little more consistently. 1 treatment in March. April, 3 treatments. Not so aggressive. May, 10 treatments. June, 8. July, 6. August, 5. This is all last year, 2019. September, 5. October, 4. November, 3. December, 2. So that is a total of 55 treatments. And now I am not working on her pain anymore. Now I'm working on something else, like having a baby, because she saw my results with other mommies. So I think that's a pretty great case study that I will talk about another time. Neurological pain, post-surgery, thoracic outlet, post-thoracic outlet surgery. That is my most recent. It is my 250th Yelp review. I have patients coming in for overall body pain. They are suffering. Chinese medicine improves quality of life. I wrote that down earlier and I want to reiterate that. There's a man coming in for allergies. It took me a long time to get to a point where 40+% of my patients are men. Sometimes it's all women here, but now these days a lot of men are coming in because fortunately the person who helped me build my brand was at the time a vice president of marketing. I have a Dr. Tan in my life who's now passed away. I'm one of his senior students. He's a man, obviously. The VP of marketing is a man, and my current business mentor is a man. And probably wouldn't care too much about me getting pissed off on this video right now, but hey, you saw a little bit of me. And that passion is what drives me to make sure that this medicine is practiced correctly and also conveyed to the planet that this is very objective medicine. Severe neck pain. There's a woman coming in for severe, and this is all in the past week. Since Monday. Today is Friday. Just going through some of my cases, not all of my cases that came in this week. severe neck pain, personal issues, low back pain. She has other health issues. She would say she's about 80-85% improved. We did hit the 95% improvement, but there was before this pandemic, there was a major family crisis that brought her down to 70-75%. Again, this is not a situation where, oh, you just feel better because you just go get acupuncture and it's kind of getting a massage and you just feel more relaxed so the pain goes away. No, that's not what happens here. It's a lot more complicated than that. It's a lot more medical than that. I mentioned how there are people coming in for depression because they're stuck at home and they had pre-existing depression issues before this pandemic. So the acupuncture helps them really cope with what's going on. There's a man who's been seeing me since September 3, 2013. He has received 178 treatments until March 17, just last week. So in 7 years, he has seen me, in about 6.5 years, he has seen me 178 times. He now sleeps 7+ hours. When he first came to see me, I did a case study on this. You can go to, this is when he was, did a case study on someone who was sleeping 2 hours a night for 15 years. I would consider that very severe insomnia. 2 hours a night for 15 years. So let's see if I actually did a video on this. I did a few insomnia cases. There is one on insomnia. If you go to elementsinharmonyacupuncture.com, I did a video on insomnia. Go to videos. And this particular patient also just recently left a testimonial. So 7 years later, he decided, you know, I'm going to do a testimonial. I actually asked him to do this one. I said, do you mind, now that it's been 7 years, sharing your story? A lot of case studies, a lot of testimonials come unsolicited. This one, I really needed the patient to share because someone was saying, hey, do you treat insomnia? And I saw him and I was like, hey, do you want to write a testimonial? Just so the person can see that it's not just me just saying it, that someone on Yelp actually shared this. If you go to elementsinharmonyacupuncture.com and you go under testimonials, one of the 3 sections, the one that's just testimonials, he talked about, I've been seeing Anna for over 6 years, and he shares the story. He is sleeping so much better. So to go from 2 hours a night for 15 years to, I think within a year and a half, I really break it down in that video. Please refer to that video. And so he has a high stressful job, and I see him anywhere between 1 to 5 times a month just for maintenance, and he gets one of the best sleeps here. So this isn't just for him to just relax. It's for him to make sure that he keeps sleeping. I would say he's pretty much graduated, but in his case, he loves to come here because this is his outlet. It's not just relaxing. I'm actually making sure that he stays healthy and strong, and the treatment stays. When there are people who just have more stressful lives out there, and they need to be able to turn off their brain, this helps him turn off his brain and makes sure that he is functioning at a high level. There's a tennis player. She's over 60 years old. She lives there at Laguna Woods, and she loves playing tennis. And with the COVID-19, she can still play tennis outside. She was seeing a physical therapist, and with that physical therapist, she didn't get, unfortunately, the results that she wanted. There are quite a few patients here who see physical therapy, who see physical therapists and get the results they want. This particular physical therapist was not helping her achieve those goals. So she came to see me, and she is so much better now. And she's only come in a couple of times, I want to say 4 times. She's happy. We still have a long way to go, but she's had it since October. I'm asking her to not play on her, I'm going to pull up her file just so I'm asking her to not play tennis until she's at least 90% for 2 weeks. So she came in, that's the wrong, here we go. We'll call her Jay. She came in March 20, 24, and 26. And she feels better. She feels overall 15% better. And you may think, oh, that's not a lot. For her, she says it's a lot because she, this is what she said in her text. When I walk, the bad left knee feels better than the right knee. Her right knee was compensating. Now the right knee is no more pain. Definite energy blockages were broken through, whatever that means to her. She's less stressed out. And she's really happy that her right knee that was starting to feel pain from compensating for the left knee is no longer there. So 2 treatments, she's at 15%. Well, she's at 3 treatments now, but after 2 treatments, she's 15% better. That's gradual improvement for her. That is more than what she, we're going in the right direction. Some people will see 50 to 90% improvement right away. And some people will just take a more gradual approach. Again, not just relaxing. We're actually making things happen. None of the needles go to the knee. In balance method, I'm doing the needles everywhere else, including the opposite elbow. I'll just share that. That's what I want to share. There's a lot. You guys got to see a little bit of my pissed off attitude. Please, I don't need you to respect me. I know what I can do. But I have some apprentices and I have some students that I teach. And if this is the attitude that you're going to give these young acupuncturists who, I like to deter people from the field of Chinese medicine and wanting to study it, because I've had to deal with bullshit like that for at least 2 decades now. And I call it bullshit. And this is probably the most passionate video I've ever had. But respect is earned. Trust is earned. And I can tell you, I have earned a lot, since 1999, thousands of patients who've respected me. And I would like to see more doctors. My patients who have physicians, medical physicians, whom they respect, typically are the ones who support them in their quest to be treated with both alternative medicine. I don't even know why we call this alternative medicine, because some people come to me straight. But let's just call it what it is, complementary and alternative medicine. That is the political term, as well as mainstream medicine. My patients who really love their doctors are the patients who love to be heard by their doctors. I have an oncology patient. She has been seeking care, alternative care for her cancer in Santa Barbara. She's getting tremendous results. Her lab tests, everything's looking good. She doesn't have any symptoms. She's been dealing with breast cancer. Today, or just recently, she just finally saw an oncologist, and this oncologist is giving her 100% support. She loves this doctor. She's been getting alternative cancer therapy for a while now. I'm here to support. I'm not the one treating her cancer. I'm just there to support her. She initially came to see me for wrist pain. So nowhere in this video am I saying I'm treating her cancer. I'm here to support her, to make sure that whatever medication she decides to do with alternative doctors helping her with the cancer therapy, or with the radiologist and oncologist, whatever kind of doctor she sees, complementary doctors, or her oncology doctors, I'm here to support her. Now, she recently saw a radiologist, and she said that radiologist treated her like a child and just scolded her. She's never going to see that radiologist again. However, this most recent physician is an oncologist and did not treat her like an idiot, did not undermine her decisions, and she felt compassion and understanding. And that oncologist called a naturopathic doctor, and I forgot what other kind of doctor they are in Santa Barbara. He called those doctors in front of her to discuss her case. So how do you think my patient feels about this new oncologist? She's in love with this oncologist. She's in love with that doctor because she felt heard. So let me tell you something about patience. A lot of patients are going to be like my patient just now, who's going to hold it in and not want to punch you when you say something asinine, like, oh, the acupuncture is just making you feel calm. And you just make them feel like, if you just take an antidepressant, you'll feel better. And then there are patients, and she's a young lady. She's in her 30s. And then there are some patients who typically, they're in their 50s or older, who might be women who are a lot more bold and who are just going to say to your face, I'm not going to see you again because you're not treating me with respect. So I am sending a clear message out. And also to all complementary and alternative doctors, you know, those of us who practice acupuncture or whatever kind of alternative medicine, we have to respect the other side. I have tremendous respect for Western medicine. And even though it may not be reciprocated, I understand. But if you just look at the results, there's a reason why Chinese government is mandating anyone infected with COVID-19 to receive Chinese medicine. There's a reason why their government would say that. And I can, there are videos in about an hour long academic videos explaining how Chinese medicine can play a powerful role in healing this planet. So I just went over a few case studies with you, some that are going through this week. Everyone here feels safe. I have done my best. I am doing my best to make sure that myself and everyone is safe. It's taken me a long time to get these little masks, and I happen to have this laying around, and I just ordered more, and everyone's quarantined in their own sections, and there's at least 6+ feet that people can stay far away. The doors are open, lots of washing hands, lots of disinfecting, lots of making sure that everyone's bringing their own blankets. I'm giving people a laundry list of things to do to make sure that we're all safe here. So I hope you can see why I'm working, and I hope you can see why California Acupuncture Board, at least up until this moment, is still allowing me to work, and I hope that they do. And I hope that they do continue to let me do, and me and my colleagues all around the state keep working. All right, have a great night, and thank you for watching this very lengthy video.